Topping your news tonight, there could be a case of the swine flu or H1N1 virus on Guam. A man arrived at the airport a couple days ago claiming to have the H1N1 virus. However, public health officials are not sure if the man really had H1N1. And if he does, they say not to worry, as H1N1 is not as big a threat as it once was.
We received a call from the Catholic Social Service yesterday regarding a call they received from a passenger that arrived, and I believe it may have been from the Philippines or from Singapore. And the person was seeking assistance from the Catholic Social Service, had indicated that he had diabetes as well as H1N1.
H1N1 is the virus commonly known as the swine flu. It's not known what exactly happened to this individual, as Bureau of Disease Control Administrator Josie O'Malley explains that no one ever had the man in their custody. All this information was based on was a phone call that the man made to the Catholic Social Services upon his arrival on Guam.
The person apparently had contacted them from the airport seeking assistance from them, and they did not have, the person with them at their office. So it was based on a telephone call from the individual, seeking assistance.
Back in 2009, the swine flu caused a bit of a scare, as it was a new strain of the flu that hadn't been seen before and that spread quickly across the globe. The good news is that it didn't prove to be that much more deadly than any other strain of the flu.
It's a strain of influenza. There are many different strains of flu, that circulate in the community, and H1N1 is one of those strains. It now, is endemic, meaning it is present throughout, the community.
O'Malley also has her doubts that the man even had the H1N1 virus, as he called the Catholic Social Services first in order to seek help with housing and food.
Immigration didn't pick up that there was someone who was presenting with symptoms, nor did the customs officers. If someone were really truly sick, they would pull that person aside and assess them, to find out, whether or not it may be a disease of public health concern.
O'Malley says that swine flu is just like any other flu. If you start having flu-like symptoms, take care of yourself. Get a lot of rest and fluids, but if you are having any complications or difficulty breathing, then go see a doctor.